Digital PCR is a highly sensitive nucleic acid quantification technology that can be used to accurately measure DNA or RNA. Compared with the traditional qPCR technology, digital PCR can quantify a small amount of nucleic acid samples more accurately and is not easily affected by PCR inhibitory substances. Digital PCR achieves accurate quantification of target nucleic acids by dividing the PCR reaction samples into tens of thousands of tiny reaction units for amplification, and then determining whether each reaction unit contains the target nucleic acid sequences. Digital PCR technology has important applications in tumor liquid biopsy. Cancer researchers can use digital PCR to detect and quantify tiny amounts of tumor DNA or tumor-related genetic mutations in blood or spinal fluid samples. This non-invasive detection method is of great significance for early tumor screening, efficiency monitoring, and prognosis assessment. In addition, the detection of minimal residual disease (MRD) cannot be ignored in the process of cancer research and cancer patient monitoring. MRD assesses the residual status of tumors in the body by detecting circulating tumor DNA in the blood. ctDNA-based MRD detection can be identify the recurrence status of patients with early-stage non-small cell lung cancer earlier than traditional clinical or imaging methods, providing opportunities for early intervention. Therefore, it is very urgent to conduct MRD detection after surgery. However, the content of tumor-derived DNA fragments in the blood is relatively low. MRD detection also faces challenges in sensitivity and specificity. As the most sensitive nucleic acid detection technology today, digital PCR has shown unique advantages in tumor MRD detection. Next, I will give you a detailed introduction to related applications. As the incidence of cancer increases, so does national health awareness. Awakening of the health awareness has increased attention on early cancer screening. Precision medicine has also begun to appear frequently in the public eye. In the area of precision medicine, liquid biopsy has become an important means in the fields of the tumor diagnosis. As a non-invasive detection technology, liquid biopsy has fewer clinical application restrictions than tissue biopsy and has received increasing attention in recent years. Research on application of liquid biopsy in MRD has also emerged in recent years. When patients receive treatment, MRD may exist in the form of dormant tumors in order to avoid being killed by drugs or the immune system. After patients stop treatment or is driven by other factors, the tumor cells in MRD will proliferate and migrate again, eventually causing tumor recurrences. Therefore, MRD detection is an important evaluation tool in a later stage of cancer treatment. If the MRD test result is positive, it means that the patient still has cancer cells remaining after treatment, and there is a risk of later recurrences. Doctors can remind patients to have regular checkups. The research data in the picture show that MRD detection can be detect cancer recurrence several months earlier than imaging. For breast cancer, recurrence can even be detected 18 months in advance. For the detection of MRD, ctDNA is an ideal marker. After radical surgical treatment, the remaining tumor cells are very few and the tumor burden is low. The amount of the ctDNA released into the blood is even lower, and the abundance may be even a few parts per 10,000 or even a few parts per 100,000. Therefore, the detection of MRD often requires a relatively high sensitivity technology. There are relatively few methods that can achieve such high sensitivity. Such sensitivity can currently be achieved by increasing the breadth and depth of NGS technology and digital PCR. Therefore, these two technologies are currently considered the key technologies for MRD detection. However, NGS is difficult and costly to perform due to these complicated experimental operations. It is difficult to achieve dynamic monitoring of patients' MRD. However, compared with NGS, digital PCR has higher sensitivity and lower cost. It can be suitable for early detection of MRD, and it is easier to realize dynamic monitoring of the entire process. Therefore, when tumor mutation site is known, we recommend the use of digital PCR for MRD detection. Then we will introduce some cases below. Circulating tumor DNA can be used for monitoring MRD. Its dynamic chains can predict tumor recurrence and guide adjustment of treatment plans. The detection of ctDNA is divided into the priori tumor analysis and unknown tumor tissue analysis. The former requires the use of sequencing to screen for specific mutations and analysis and detection them through highly sensitive methods such as digital PCR. The latter does not rely on tissue and performs tumor analysis by detecting specific methylation. Neoadjuvant chemotherapy is an important treatment for stage 3 breast cancer. The purpose of treatment is to reduce the size and stage of the tumor so that patients can have chance to treatment or breast conservation. For neoadjuvant treatment, pathological evaluation of this breast specimen is very important. An assessment that can predict patient's prognosis and efficiency. The current assessment method is mainly PCR combined with imaging and tumor biology. However, this method can only detect tumors when they reach a certain level, and the sensitivity is very low. Therefore, a biomarker and highly sensitive detection technology are now needed to predict occurrence and development of tumors. The author studied the value of ctDNA in monitoring patients before, during, and after neoadjuvant therapy, as well as the value of circulating tumor cells during clinical progression. Monitoring patient blood ctDNA by constructing a digital PCR method. The study first conducted a tissue sequencing on 45 specimens. The test results show that the target with more gene mutation is TP53, with probability of about 76.9%, followed by PIK3CA and FGFR. Then, 28 patients with detected mutations were subjected to personalized digital PCR testing to track this mutation in ctDNA. During neoadjuvant treatment, the blood ctDNA of half of the patients would turn negative, and the ctDNA levels of patients number 17 and number 4 decreased. After neoadjuvant therapy, ctDNA was also detectable in 43% of patients. Overall, ctDNA declined rapidly after neoadjuvant treatment. Before surgery, most patients can achieve ctDNA negative. There was no difference in initial event-free survival between ctDNA positive patients and negative patients who received late-stage neoadjuvant therapy. After 2 years, the event-free mortality rate was 57.1% for positive patients and 66.7% for negative patients. However, positive patients have higher risk of recurrence than negative patients. During the postoperative ctDNA testing of 24 patients, the negative rate of the first test was about 83.3%. Among the 4 positive patients, 3 experienced recurrence, an average of 6.5 months after surgery. Among the patients who tested negative for the first time, 3 patients became positive 12% 7 months after surgery on average. The metastasis occurred 8.9 months later. The positive predictive rate of ctDNA after surgery was about 85.7%. The combination of NGS and digital PCR can complete the screening of breast cancer tumor, ctDNA, and development of monitoring plans. The content of ctDNA in the blood is relatively small, especially during and after treatment. The content will be very low. Digital PCR has very high sensitivity and is easier to implement than NGS. The following study is a good proof of the monitoring of the entire treatment process. This study is to construct a digital PCR method to detect the content of the muted genes during leukemia treatment and later stage of treatment, to evaluate treatment options and risk of late relapse. From the picture, we can see that the first BCR-ABL gene test was conducted in September 2018. After 3 months of imatinib treatment, the content of the muted gene increased approximately fivefold. So NGS testing of this domain revealed that T and C bases has been replaced, resulting in drug resistance. By using the second-line treatment drug dasatinib, the level of the BCR-ABL in the peripheral blood can be reduced to less than 10%. The level of this MRD was measured in another patient who has been treated with dasatinib for 1 month. The flow cytometry test results was 0.17%. Then, when MRD is less than 0.1%, flow cytometry cannot detect it. Then, when MRD is less than 0.01%, next PCR cannot detect it either. However, sensitivity of digital PCR to detect MRD can be 2 orders of the magnitude higher. In NCCN guidelines, for MRD detection of TKI therapeutic effect, commonly used detection methods include flow cytometry, qPCR, and NGS. Flow cytometry and NGS can be used to detect a broad spectrum of target for MRD. However, the sensitivity of the former is relatively low. In a dynamic monitoring process of CML, NGS is not applicable as I mentioned earlier. However, when commercial kits are scaled, qPCR tests are developed in-house and need to go through a sufficient verification process. This is very expensive, labor-intensive, and time-consuming process, and may affect detection sensitivity when target concentration is relatively low. Therefore, digital PCR has great potential in the fields of MRD detection. This is our perfect solution for leukemia detection. It can detect CML or and other types of leukemia. At the same time, it can also complete the screening of multiple leukemias in one sample. This is the result of our CML detection. The upper farm channel indicate the copy numbers of the P210 genes. The lower hex channel indicate the copy numbers of ABL gene. The detection sensitivity of this detection solution can reach 0.001% or even lower. In addition to detection of leukemia, we have made a lot of the expansion in the field of tumor detection, including the development of the detection kits for EGFR mutation sites in the non-small cell lung cancer, detection of the KRAS mutation in lung cancer and gastric cancer, detection of IDH1-2 mutation in glomia, and detection kits of the PIK3CA BRAF sites, etc. Breast cancer HER2 gene detection kit. These kits are developed based on digital PCR platforms and can complete quantification detection and analysis of genetic mutations. Okay, many principles and applications of digital PCR have been described previously. So, how do unicorn digital PCR products operate in a laboratory? Then let's watch the whole process closer. Now, let me introduce to you our company's digital PCR products. Then, a core part of the digital PCR is preparation of micro droplets. We at Unicorn use the microarray chips to do droplets preparation process. As you can see, we have formed tens of thousands of the micro cavities in this thumb-sized chip. Then I put our PCR reaction system into this chip to achieve the distribution of tens of thousands of reaction units and then perform independent PCR amplification. This is the reaction system for digital PCR we just prepared. This system contains a total of 20 microliters, which contains the enzymes, primers, probes required for digital reactions, as well as the target nucleic acids we want to detect. Next, I will demonstrate to you how the PCR reaction system generates droplets. Now, our entire sample preparation process has been completed. Next, we need to put this digital PCR chip into our digital PCR all-in-one machine for amplification and analysis. Open the hatch now. After placing this chip, the hatch can be closed. Next, we perform PCR amplification with this machine. This is our latest digital PCR all-in-one machine launched by Unicorn. Then it has integrated the entire PCR amplification module and optical reading module. Then our entire digital PCR detection process can be complete through this machine. This machine has some features. It is the machine with double hatch design. Its higher throughput can detect 48 samples. Now, for the first hatch reading, if you have another projects to be carried out simultaneously, you can open the hatch again and put your samples into the second one. Therefore, it is entire modular and independent design is quite distinctive. This system is configured with 6 color of fluorescence and can detect up to 6 targets. Our entire detection time is relatively short, and you can basically achieve application and final rating analysis within an hour and a half. Therefore, AQ1 300 instrument is very competitive in the market. Now you can see a very small digital PCR product next to it. I would like to introduce this product also. This product is unique meeting digital PCR product in the world. This system is configured with dual color fluorescent channels and it can detect the mutations in some tumors. You can use that as a hatch and it's a single hatch design. You can put the chips in and just prepare it to the catch and close it. At this time, it can take pictures of the chip and it can take a photo of this chip just a few seconds. So at this time, we can take it out, exchange it to the second chip, then put it for the reading. Reading the entire 12 photos takes just over a minute. Next, we can lift the instrument and let it complete the software analysis by itself. Now the analyzing process is complete. Let's have a look at our software. From the results of the digital PCR analysis, we can see that this time we did 6 full target tests. Its data has been very clearly presented on the software interface. Let's click on one and have a look at the results of digital PCR. The display is very concise and clear. Above is our positive signal, the below is our negative ones. The concentration calculation results can be obtained based on the number of positive signals. The concentration results detected by this auto channel is 7 to 1 copies per microliter. Different channels can also see very clear results. The most amazing features of digital PCR is that it has very good results in detecting samples with low concentration targets. As you can see from these results, the target content of the original sample is very low. The overall blood data detection results is at a few copies per microliter. Calculating to this original chip sample, there may only be a dozen fragments of target molecule, but digital PCR can still present it very clearly. Or in more, the application of digital PCR technology in tumor liquid biopsy provides a highly sensitive and high-precision molecular biology tools for tumor diagnosis and treatment. It is expected to bring new breakthroughs in personalized treatment and prognosis assessment for tumor patients. Of course, we also hope that digital PCR technology can be used in more and more scenarios. Thank you for watching.